The definition of presentation, position and posture of the fetus in cattle, normal and abnormal presentations in cattle. The presentation is relation of the long axis, so the column direction of the fetus, to the long axis of the dam. The good presentations are longitudinal, anterior or posterior. Anterior is when the face is heading out, and posterior is when the feet are heading out. The bad positions are ventrotransverse, so the tummy's coming out, or dorsotransverse, so the back is coming out first. Or oblique ventrovertical presentation. It's also called the Harm's dog sitting position. This is when the back leg is coming out with the front leg and the head. In the posterior position, the bony knob you feel is the calcaneus. In the posterior position, the bony knob you feel is the calcaneus, and it's the second joint that you feel after the fetlock. For positioning, this is relation of the vertebral column, so the spinal process of the fetus in relation to the vertical column of the dam. So we always want the spinous processes of the fetus pointing up, the same as the dam. The posture is the relation of the extremities, such as the head, neck and legs of the fetus, in relation to its trunk. So during pregnancy, you want these extremities to be flexed, and during birth, you want them to be extended. The problem with the head can be lateral deviation, or downward vertex, or a breast head, or an upward facing head. For the forelimb, the problems can be carpal flexion, an incomplete elbow extension, or a shoulder flexion, or a foot nabe. This is when the head is below the legs. And for hind limb, the problems are hock flexion and hip flexion. So for a summary, during pregnancy, you want a longitudinal presentation, anterior or posterior, and you want them to be in the dorsal upright position. And the extremities will be in a flexed posture, but during delivery, they'll be in an extended posture.